All right, everyone, settle in. Today we're tackling the most important test of your career, the next generation NCLEX. This is your masterclass on how to prepare and pass. The NCLEX has undergone its biggest overhaul in 30 years. It's no longer about rote memorization. The new universal standard is clinical judgment. To pass, you must stop thinking like a student and start thinking like a safe beginner nurse. The exam measures your ability to make safe decisions in real time. This shift is centered on the Clinical Judgment Measurement Model, or NCJMM. It tracks how you make decisions in a real-world clinical environment. Step 1 is recognizing cues. You must identify what information from the patient's assessment is relevant and concerning. Then, you analyze those cues. You are linking the data, like a rising heart rate, to potential underlying conditions like shock. Next, prioritize your hypotheses. Which patient problem is the most urgent? Which risk needs your attention right now? Now, generate solutions. You are identifying the specific nursing interventions that will achieve the best outcomes for your patient. Finally, you take action. Select and implement the most appropriate implementation to address the clinical priority. The cycle ends by evaluating outcomes. Did the patient respond as expected? This clinical loop is the key to every NGN question. The exam is a computerized adaptive test. You'll face anywhere from 85 to 150 questions. You have a 5-hour window. This isn't just a test of knowledge, it's a test of mental endurance and focus. The centerpiece of the NGN is the unfolding case study. The patient's condition evolves with every question you answer. You'll have at least 3 of these cases. They mimic a real-world clinical shift, forcing you to prioritize in real time. Get ready for innovative item types. You'll encounter matrix grids, highlighting concerns in medical records, and the bowtie model. Extended multiple response, or select all that apply, is back, but with a much fairer scoring twist for the new era. Scoring has revolutionized. You can now earn partial credit. On SATA questions, you get a point for every correct choice. But be careful, you lose a point for an incorrect guess. It's statistically safer to only pick the options you are certain about. Preparation is key. Platforms like UWorld and Archer provide cue banks that perfectly mimic the NGN interface and rationales. Don't forget legendary strategies from Mark Klimak on prioritization or the Kaplan decision tree for navigating complex choices. When in doubt, always prioritize safety. Use the ABCs and Maslow's hierarchy to decide what your first action must be. Master the tabs. Get comfortable flipping between history, physicals, and vitals. The answer is often hidden in the data. The NCLEX is just the final hurdle. Stay diligent, build your testing endurance, and trust your clinical judgment. You've worked hard for this. I'm Nurse Dante, and I'll see you in the clinicals with that RN after your name. Please like, share, and subscribe if this was helpful to you. Thank you for watching this video.